You're listening to Talk of the Town on KQNA. Once again, here's your host, the director of the Prescott Chamber of Commerce, Sherry Heine.
Welcome back, everyone. You're listening to Talk of the Town on KQNA. It's Prescott Chamber Day, and Robert, you're here to introduce our very first guest.
Thank you, Sherry. Good afternoon, everyone. Our first guest is from Santa Behavioral Hospital, and we have Dr. Elizabeth Caspian here.
Hi, it's good
Welcome
to be here.
Welcome to the show.
Yeah, thanks
nice
for
to
having
have
us.
We were just reminiscing about this hugely successful ribbon cutting on Monday.
It was very successful.
Yes.
Delighted at the turnout of the town. It seems like the town is very excited to see what we're up to and what we're going to be doing for seniors living in your community.
Mm-hmm, mm-hmm.
Let's tell us, Dr. Elizabeth, tell us a little bit about yourself before we dive into the Santa Behavioral Hospital.
Well,
where you're from and good things like that.
Sure.
Everybody wants to know.
I'm Dr. Elizabeth Caspian. I'm a transplant from back east. Grew up in North Carolina and did my residency training at University of Kentucky. Wow. And made my way to the lovely state of Arizona, a beautiful state to call home. Mm-hmm. Grateful to be here. Have been affiliated with other hospitals in the community for about 14 and a half years. And now excited for this next new adventure in taking care of our senior population in this wonderful town of Prescott.
Well, I think Prescott is all very excited about it, too. We've been watching the building come up.
Yes.
In the past few months, and folks have been asking us, what's going on down there? So now they'll know.
Yes, and I'll be serving as their medical director. And I just want to say that I'm really excited about what Santa's going to be doing in our community. Getting to know the folks that are behind us and behind this adventure, and they're very dedicated to the absolute best in client care, patient care delivery for patients and their family members, recognizing that we have a growing population of seniors. The statistics are pretty staggering. One that I read today, by 2040, 1 in 5 Americans will be 65 or older. And that's up from 1 in 8 in the year 2000.
Wow.
So think about that in just a 40-year time span, from 1 in 8 age 65 and older to 1 out of 5 Americans will be 65 or older. So it's very wise of any businesses to be thinking about how to better serve our senior population.
Mm-hmm. And we've always had quite a few seniors in this area from many years past, but now it's the different type of seniors. I think it's the seniors like me.
Yes.
Actually, I guess I would qualify in that little area.
Well, I'll tell you.
We're taking better care of ourselves or something, too.
We were talking about how do you define a senior, and all of us in the room obviously are what would be qualified as senior, 55 and older. And the joke was, well, whatever senior is, it's whatever's younger than we are.
There you go. Just for the record, I cannot be considered a senior yet.
Sherry's not a senior. We have a child in the room.
I was waiting till you said the age. I'm like, okay, I'm clear.
I have one more year, and then I get that wonderful title of senior.
Oh, that's great. Well, share with us what's the hospital going to provide us for services?
We are a behavioral hospital, so we will be meeting the needs of seniors in the community that are challenged by a mental health issue. Of course, you know, as we age, myself included, life certainly feels different to me at 50 plus than it did prior to 50. More healthcare challenges, more losses. So it's a challenging time for folks mentally, and we're going to be there to meet those challenges and help support patients and also their family members in addressing those challenges that show up that are unique to that population. So we're very, very excited to be here to specialize in that group.
Well, I'm thinking that you'll be working pretty closely with some of our medical facilities in the area, like Yavapai Regional Medical Center, West Yavapai Guidance Clinic.
Yes, we will be partnering with many, many agencies in the community, from assisted living facilities, the emergency departments, law enforcement when there's a senior in the community in need of assessment, all of our partners in the community that address mental health issues will all be working together to figure out what role we can play in particularly addressing the senior population needs. And what we are excited about is that currently, without a specialty hospital such as Santa Behavioral Hospital, seniors are often, they have to go to Flagstaff for care or many down to Phoenix for specialty care. So now these folks will be able to stay in their communities, closer to their families, their loved ones, and the community caregivers that are involved in their care. So we anticipate an incredible increase in the experience of the patient and their family member. It's very stressful when you have a family member such as I had very recently in Phoenix, and I'm having to leave my home and go to Phoenix to help take care of her. So it added additional stress to all of us. So it's going to be very nice for family members, caregivers, to be able to see their family and their loved one treated in their very own community. And that's what we're very excited to offer.
Well, you have the beautiful facility. Tell us about the facility. When I hear the word hospital, I think rooms and inpatient. Is that true to your organization?
Actually, what I love about this hospital is the great effort they put into making it not feel like a hospital. In my career, I've been in medicine now for 25 plus years. I've worked in many, many facilities, and you walk in, it sort of feels institutional. And this hospital feels so different. You walk into the rooms, and there's natural lighting. I love that they raised the ceiling on the building to bring in the clouds. So when you look up, you actually see clouds. The art on the wall is nature. So when clients are there with us, they're going to not feel like they're in an institution. They're going to feel like they're in a home environment. And that's what is really wonderful, that they put a lot of thought into the building itself. What I also love about this organization is the thought they put into the staff that will be there at the hospital. I've had the pleasure of working with many of them. Pam Pierce, their CEO on site, many of the folks that are going to be there working with us, Paul Smith, the pharmacist. We've all had the opportunity of working together at other facilities in the community. And these are people that honestly do unto others as they would have done unto themselves. So they will treat your family members, your loved ones, the way that you would want them to be treated, because they would do for them what they would want done for their own. And I just love these people. They're really heart-centered, golden-hearted people.
That sounds great. And so you're going to be opening your doors soon.
Yes.
Your first clients by the beginning of the year, somewhere in that time frame.
Yes, that's what we're hoping. By the end of the month, beginning of next year, we'll have our first patients in the doors, and we'll be delivering care. So we're doing all the background, behind-the-scenes work to make that happen, and getting very excited.
But folks, if they're curious about Santa, they can just drop by and take a peek, or give them a call and do a tour.
Hospital administration at 928-227-3424 to arrange a tour. So if you were busy and could not be at our amazing ribbon cutting ceremony.
Yeah, I haven't been, but I'm intrigued now when you said you can look up and see the sky. I thought, boy, this is kind of a neat building.
Absolutely.
Please come, and I'll give that number again. Arrange a tour at 928-227-3424. So if you were not able to drop by and you're curious about it, please come. When we do have our first client, of course, confidentiality will prevent those tours being readily accessible to the public. So now's the time to drop by and see what we're up to and see the beautiful building, and to meet and greet those of us that are going to be working there.
And let's share with our listeners the address. Maybe someone hasn't recognized the big building being brought up.
Sure. It's on Whipple Street. I believe the exact address is 181 Whipple. So, yes, and a beautiful, beautiful building.
It's on the way to the YMCA. Most people know where the Y is.
Yep.
You're across the street from the Y.
Correct.
Kind of across the street from Alta Vista.
Alta Vista, yes. We're right down the hill from Alta Vista.
Nice.
So you've been involved in this kind of work for a while. What's the most rewarding aspect of it for you?
What's rewarding is when a patient is able to share with you that you took the time to truly listen to them, to really pay attention to not only their medication needs, but their psychosocial needs. And you put it all together in a fancy word called biopsychosocial model. You pay attention to what's going on biologically, what's going on psychologically, and coping skills. Have their coping capacities been overwhelmed by some challenge? And what's going on socially that's creating a challenge for this person? So we're a team. We have social workers, we have counselors, psychologists, and we have Dr. Downing, who's a longtime primary care provider in the community. He's going to be joining us to help us look at the medical piece. Myself, a psychiatrist, and we also have Paul Smith, the pharmacist. And that's one aspect of this hospital I'm particularly excited about. There's a concept in senior care called deprescribing, when you look at sometimes it's the medication interactions that are causing trouble. Mm-hmm. So oftentimes our primary care providers are busy, they're seeing patients in a hurry, not able to slow down and pay attention to those issues. So we're going to be able to do that for folks and hopefully minimize drug-drug interactions. So we're excited to have a pharmacist on this team. So we're going to be doing some really wonderful things.
That sounds great. Well, we're so thankful that you're part of the Chamber family now, and we appreciate and we're here to help you in any way we can.
Well, thank you.
So welcome to Prescott. And you're listening to Talk of the Town on KQNA, 1130 AM and 99.9 FM in Prescott, 95.5 FM in Prescott Valley and Cottonwood, and streaming live worldwide at kqna.com.